Hi, thank you for tuning in to Global Elite Consultant, brought to you by Global Elite Academy. If you have any questions that you want to ask us, or you want more information about opening up your own non-medical home care agency, please go to globaleliteacademy.net. That's globaleliteacademy.net. And you can get the phone number and give us a call. Now, today we're going to talk about opening up a non-medical home care business in South Dakota. In South Dakota, you do not need a license or certification to open up a non-medical agency. So that means it's an unregulated state. You still need a certification to open up a skilled agency, but not a non-medical agency. So now the only thing you have to do is get your business registered, decide on what structure you're going to as your business, like LLC, corporation, or individual. Obtain your EIN number by going to irs.gov. You can apply online, and it'll give you your EIN number, which is your employee's identification number. Okay. You also need to have insurance, though. So if you're going to have W-2 employees, you may need to contact workman compensation and get the workman compensation insurance. If you're going to use 1099 employees, you need to get your business insurance against liability. If it's snowing outside and the caregivers fall, while going to a patient's house and they want to sue, you'll have your insurance for things like that. So make sure you still get your insurance to operate. For a non-medical agency, you do not need to have a nurse. You need to have an administrator who's going to be over it with at least 2 years experience. And make sure that your caregivers have at least 1 year experience working in home care. You have to create your policy and procedure manual, which we can help you do that. Just contact us at globaleliteacademy.net, and then we can help you create your policy and procedure manual. You need your other software set up, like for scheduling, for the caregivers to be able to clock in and out, for billing, and for invoicing the patient. So you have to decide, how you're going to do that and set up the appropriate software for that. Then you want to market your agency. That is very important. Market your agency. If you contact me, Dr. Patricia, at globaleliteacademy.net, go in there, get the phone number, give me a call. I will give you the number to the person that I refer to they do marketing, and in about 2.5 months, they'll get you on the first page of Google. And so just contact me and I can give you that information. And If you have any questions, like always, put them in the chat area, and then I'll, look at it, read it over, and answer any questions that you have listed. I think that's about all that you need to set up your home health agency in South Dakota. I'm going to do another audio on how to can you apply for IHSS. Well, you know what? I'm just going to put it on this one. I'll just go on and put it on this one. You are able to apply for IHSS, which is the low income for patients who are looking to get home health care and they don't have the money. They can apply at the for community-based help, which is IHSS, in-home support services. And you'll be able to get more customers. You'll be able to get more customers that low income. If you don't get IHSS, then you will have to get private pay patients. So you want to be able to get IHSS because that's low income patients that you could take. The government, I'm not sure what they're paying in South Dakota, but I know in Arizona and Denver, they're paying about $29 an hour for low income patients. So you might want to apply for that because that'll give you more patients. It's so expensive to get to get home care. And so for these people, if they don't have a program like IHSS, they cannot afford home care. So you want to make sure that you also, get low income as well, which is IHSS. So now in South Dakota, it's not called IHSS. In South Dakota, it's called Medicaid waiver provider. That is what it's called. Medicaid waiver provider. So in order for you to get this, to be able to get these patients, you have to fill out an application. You get an NPI number. You can go on the national website and get an NPI number. That's the number that they will use to bill you. And then you fill out your application. And then they'll come out and they usually come out and do a survey and make sure you have the policy and procedure manual and all that, and before they issue your certification. You do have to have a background check when you're applying for IHSS. And let me see. So the NPI number is for your provider ID number and the billing. Medicaid uses that number for billing, and also it's your provider ID number. And they call this program again Medicaid waiver, and it's brought to you by the Home and Community-Based Services. These programs provide service to various populations, including individuals with disability, the elder, and those with chronic medical need. It also offers young adults, like starting at the children. I think they have disability children, I think, that you also could take individual children. So when you apply, you would just let them know what type of patient you want to have. Okay. So before applying, you want to make sure your agency meets the criteria. So you have to make sure that your staff is trained. You have insurance coverage. Let's look and see what all they're requesting. So they're requesting for you to have, for your business to be established. So it needs to be a LLC, corporation, or partnership with a South Dakota Secretary of State. You will need to obtain the employee EIN number from the IRS. And for that, you do irs.gov. You need to secure your liability insurance in South Dakota. And then you need to check with the South Dakota DSS for the minimum coverage amount required. You want to make sure that all employees have at least, I think for this Medicaid waiver, they require for the direct care workers, home health workers, personal care workers to have at least 1 year experience, and you have to continue educating them throughout the year. So once they, you hire them, then you have to provide training for them throughout the year. You could give training every three months, or you could give training, once a year. It also says that they need to have your caregivers, when you hire them, they need to have CPR, first aid. You have to do a background check, like you would automatically do that on any employee. And then you need to complete the South Dakota Medicare waiver provider's application. To access the application, visit the South Dakota DSS website and download the Medicaid provider's enrollment application for waiver services. Okay. And I told you the documents you're going to need. You're going to need your business registration, proof of insurance, staff qualification, with your staff training, employees background check, your policy and procedure, including the client's intake documentation, incident reporting, etc. It's just your policy and procedure manual. And your IRS W-9 form for tax identification purposes. Those are the forms that I guess they want you to upload those forms when you fill out the application. And then, like I said, you need to develop the policy and procedure manual, which we can help you with. And you need to have a care plan, incident reporting, documentation, and record keeping. So what software are you going to use for record keeping and documentation? And then you submit your application and all required documents to the South Dakota DSS Medicaid Provider Enrollment Office. And be sure to follow any special submission instructions. And then you're going to have to do a background check. And then, like I told you, they'll come out to do a survey for your agency.